Are you feeling a sharp pain in front of your hip whenever you squat, lift your knee, or kick? This stiffness and pain is not only frustrating, it is your body telling you something important. The good news though is that you can fix it. And today in this video, we're going to be going over a self-test to determine if you're dealing with hip impingement, as well as 3 powerful drills to address it safely so that you can move pain-free again. Hey guys, Dr. Neil Toussaint with TrickStrong.com, where we help you do what you want, even when pain or weakness get in your way. In this video, you're going to learn how to test for hip impingement, or basically if your hip is jamming, how to create clean space in your hip, how to strengthen that new space, and lastly, how to maintain these drills so that you can train pain-free without flare-ups. When your hip joint runs out of clean space during movement, it can actually rub and jam together, causing that painful, sharp pinch that you're feeling in the front of your hip. Instead of forcing through it like a lot of people do with their mobility drills, we actually want to create new space, strengthen in that new range of motion, and maintain healthy joint mechanics. Here's a quick way to test yourself for hip impingement. We call this the FADIR test. So you're gonna sit at an approximately 90-degree angle with your hips, and you're gonna bring your knee towards your other knee with your foot planted. This is gonna bring us into that flexion, adduction, and internal rotation at the hip that's closing the hip joint off. And if you have hip impingement, it should bother you when you get to that end range. To double check, I'm gonna have you stand up and you're gonna put your foot on top of the chair that you were sitting on and then go into deeper hip flexion. So you're gonna be above 90 degrees now. Your knee should be closer to your chest. From here, you're gonna push that knee in and do that same thing. And if it's pinching earlier or the pain is sharper or more aggressive, then we know that we are dealing with hip impingement, or at least a limitation in this flexion and internal rotation pattern. And if you felt that pinch, no worries. This is exactly how we're gonna fix it safely and progressively. First, we're gonna create space inside the hip joint using a banded hip mobilization. What this is gonna do is it's gonna traction the hip, so it's gonna gap the hip, creating a little bit more space in that joint. We're gonna need a very strong pull-up assist band or power band that's going to be strong enough to pull the femur away, because these are very strong joints, so we're gonna need a lot of force to do this. You're gonna put this up in the hip crease as I'm showing you here, and we're gonna walk away from the anchor. You have to anchor it to something that is immovable, or else it'll fly out of whatever you've anchored it to. Walking away and then going down to all fours is much easier than trying to do it from the ground, so definitely do it the way I'm showing you here. From here, you're gonna rock back and forth into like a child's pose position. So basically sitting your butt back towards your heels, and you're just gonna keep moving through this range of motion, maybe 1 to 2 seconds per rep. If you're feeling okay here, you can actually advance this drill by going into a little bit of internal rotation at the hip by flaring your ankle outwards. That's gonna put us into that more hip closed position, and then now we're gonna be stressing that to try to open that limitation that we have in flexion and internal rotation. Start with 1 to 2 sets of 20 reps before we go on to anything else. You might feel some immediate relief, and that's great to know because you can use this for warm-ups, but unless you fill this in with active work, it's probably going to be temporary. So in this next section, we're gonna be going over how to expand space actively and how to build strength in that new space that we just got. Next, we're gonna do the 90-90 internal and external rotation with contract, relax reps. So this drill is going to actively create more space in our hip joint, helping to strengthen our hip at end ranges, and also longevity of the joint. It's going to help with that pinching sensation that you're getting. Pretty much if you're a human, you need to be doing this drill. So we're going to start in a 90-90 position. That's going to be with your ankles, knees, and hips at a 90-degree angle as shown. We're going to be on the ground and supporting our weight with our hands as well. So first we're going to work on external rotation. We're going to go down into that front hip, almost like a pigeon stretch. So that back leg is still going to be bent as we have it here. And that front leg, we're going to be pushing our chest towards that shin. We should be feeling a nice stretch in our glutes. From here, we're going to do a 2-minute hold. The reason it's so long is because we really want things to relax, and this actually has been shown to produce collagen, which is going to help us with our connective tissue and extensibility of our hip joint. After the 2-minute hold, we're going to do 5 contract, relax reps. So what this is going to look like is you're going to be pushing your whole shin actively towards the ground, and you're going to be feeling that loading going through your glutes. You're going to push that for 5 seconds and then relax and see if you can go further into the stretch. You're going to repeat this 5 times before moving on to internal rotation. So when we go to internal rotation, we're actually going to be able to stay in that same 90-90 position, but now we're just going to stretch the back leg. This back hip, you're actually going to bring the hand on the side of the hip that you're trying to stretch. So if it's your left hip in the back, you're going to bring your left hand around to face that hip. A key here for you, especially if you're having those hip impingement symptoms, is that you're not feeling a pinch during this stretch. So you're only going to rotate your trunk as far as you can without pinching. To intensify this stretch, you're going to lean forward on top of the hip that you're stretching, so on top of that back hip, and to reduce the amount of stretch, so let's say you're pinching, you can lean back and use your hands to support yourself. We want to feel a groin stretch here, not a pinch or pain here. That's very important, especially with this issue. You're going to hold this stretch for about 2 minutes, and then after that 2 minutes, we're going to do the same thing. We're going to push our shin down straight into the ground, and you should feel that groin loading a little bit more. This push should not cause your pinching. If it does, then you're gonna have to push a little bit lighter or get a little bit out of the stretch and ease it a little bit. The strength that we're using for these contract relax reps, both for the external and internal rotation contract relax reps, is maximal. We wanna push as hard as we can without increasing our pain. So if that's only 10, 20%, that's okay, that's where you're gonna start. But soon we wanna get to maybe pushing be able to like 70%, even to 100% of your effort without pain. That's how we know that we're gonna create more space in the hip joint and create more end range strength in that hip so that we build that connective tissue. If the mobility requirements of this 90-90 position are too much for you, you just can't get into these stretches without feeling a pinch or pain, then I would advise you to use an adjustable bench or something similar at home. What this is gonna do is it's gonna allow you to choose the range of motion that actually fits what you're able to do at the time. So you can adjust that bench to whatever you need it to, and then you can see us doing the pigeon version. You'd still hold for 2 minutes and then push into the bench with your shins. And then here's the internal rotation version, where we would adjust the bench to a comfortable range of internal rotation that you can handle, but you do want to feel that stretch. And of course you can turn towards that leg too to get more of a stretch. And you're going to push into that bench with your shin for those 5 seconds. And you're going to do 5 cycles of that, just as we did on the floor. Now that we've expanded your hip joint space, we're going to build some real strength and control through it under load. The Kickstand RDL is where it all comes together. This is going to be an amazing drill to not only build strength in the ranges that we just created, but in order to build new range, because this load is going to help push our hip. It's going to help mobilize our hip into even greater ranges of motion. But it's really helpful to do those first 2 drills prior to this to help create the space so that we're not just pinching into it, but we're actually going to be able to use this drill effectively. In order to perform the Kickstand RDL correctly, I'm actually gonna have you do this body weight first. You're gonna take one hand and you're gonna put it in front of your hip. So your opposite hand, you're gonna put it right in front of your hip and you're gonna point at the front of your hip. The back hand is going to be on your glute and you're gonna feel that stretch as you hinge down. A hip hinge requires that you're bending forward at the hip, not through your lower back. So you want to keep a nice neutral posture there as you hinge through that hip. So it's going to be pushing your hip back. And these fingers are going to help guide you so that you're really pushing that hip back and feeling that extensibility through the back of your hip. You should not feel a pinch here. If you are, then reduce the range of motion until you're not feeling a pinch. Get used to these reps and get used to really driving through your glute and hamstrings to rise and to feel them lengthening during the descent. Once you're able to do this comfortably and you have a good hang of it, it's time to grab a weight. You're gonna grab a weight in that opposite hand, and your target for that weight is gonna be right over the foot that you're working on, so that front hip. Notice the back hip, we call it a kickstand because the back hip is in a staggered stance where we're just using it for balance, we're not using it for support. So about 10% of your weight is gonna be in that back hip. You're rotating over that leg so that weight is gonna go right above that foot and come back up. You should still feel that same or even greater expansion through the back of your hip, especially at the bottom of the rep. And you should really feel your glutes and hamstrings working hard to pull you back up to stand. Once you master the Kickstand RDL with weight, you can actually add a 3D element to it. So I like to do 3 directions in order to fully strengthen and bulletproof our hip through multiple ranges of motion. So we're gonna go directly over our foot for that first rep. Then we can go to the outer part of our foot for that second rep, and then the inner part of that foot for that third rep. So I like thinking of them in 45-degree angles so that you're hitting all of those ranges in flexion. This is really gonna help you own that hip space under load. When you combine relief, expansion, and strength, you're not just treating symptoms, you're actually treating the root cause and building a hip that can actually be resilient with your movement. But if you want a complete step-by-step approach for your entire body to fix pain, rebuild strength, head over to TrickStrong.com and check out the TrickStrong RX app. It is designed for movement artists and creative athletes such as yourself to not only get out of pain, but in order to improve strength and resilience and get back to doing the things you love. If you want to keep building that lower body resilience, then head over to this playlist where we go over bulletproofing your lower body, hips, knees, ankles, and connecting them all so that you can move the way you want. All right, guys, train hard, stay safe, and we'll see you soon for the next one.